Hi, I'm Carl Turner reporting for Pixels and Pills from Digital Pharma East, and I'm here with Kevin Clauson. Kevin, you have a really interesting background, and we just caught you as you were walking through the conference. Can you tell us a little bit about what brought you here today?
Sure. I'm a pharmacist by training, and I'm assistant or associate professor at Nova Southeastern University. Today I was presenting on social media research partnering between academia and industry.
Okay, and great. As you watch the presentations, is there anything from an academic perspective that you feel like is missing from the conversation?
I think in some cases there's missed opportunities to involve research in the process, both in terms of, in some cases, the rigor of the methodology with some of the types of marketing research that's been done. As well, I think it would be great and ideal to have sort of all three pieces be involved in terms of industry, academia, and the sort of burgeoning e-patient population, especially as it's starting to look like e-patient communities could sort of be the next virtual community-based organization. So to see that sort of true partnership is maybe the one thing that's kind of missing so far.
Okay, and we were talking a little bit about some of the research that you've conducted, and it sounds really interesting. I was hoping you could give us some details on some of the research that you've actually conducted.
Sure. So my main area is consumer health informatics, and that includes a sort of umbrella term, M-health, social media, et cetera. So as far as some of the things we've already published, we did a study a couple of years ago in the Annals of Pharmacotherapy looking at the quality of pharmaceutical information in Wikipedia to see, were there errors, were there gross errors, was the information missing? And what we found was, kind of to our surprise, was that there were almost no errors of commission, so no information that was factually wrong that was there. Wikipedia did very well. The flip side was that there were a lot of errors of omission, so there was missing information, and especially some of the safety information, that was kind of a concern because we know that patients are turning more and more to sources like Wikipedia.
Right. Now, in terms of the conference in general, what has your perspective been? Are there any presentations that you've heard that were particularly interesting to you? Anything outstanding from the conference that you'd want to mention?
Sure. I think that Dr. V's keynote was really good. I think he helped bring a dose of reality to a lot of people in terms of what their challenges are in dealing with physicians. One that I thought was particularly outstanding, I think his name was Ian Talmadge. He was a former current marketeer who himself is kind of a patient, e-patient, and he was just a great storyteller. That's sort of that's the highest compliment I think you can pay a presenter is he's a good storyteller, and he just made a very compelling case for changes that maybe need to occur within the industry and some of the positives that can be outcomes coming out of it.
All right, thanks for your great perspective, Kevin. All right, thank you. I'm Carl Turner reporting for Pixels and Pills from Digital Pharma East.